Hello and welcome. Today, we're diving into the complex world of the nervous system to understand a condition known as plexopathy. This involves damage to a network of nerves called a plexus, impacting movement and sensation. Join us as we explore the causes, symptoms, diagnosis, and management of this often debilitating condition. So, what causes plexopathy? The reasons can vary significantly. Traumatic injuries like car accidents or falls are a common culprit, stretching or tearing the nerve fibers. Other causes include compression from tumors or hematomas, inflammatory conditions like brachial neuritis, radiation therapy, and even certain infections. Sometimes the exact cause remains unknown, classified as idiopathic plexopathy. To understand plexopathy, we need to talk about what happens inside. A plexus is essentially a junction box where nerve roots from the spinal cord converge and redistribute to form specific nerves that innervate the limbs and other parts of the body. When a plexus is damaged, nerve signals can't travel efficiently. This disrupts the communication between the brain and the affected muscles and sensory receptors. This disruption results in muscle weakness, sensory loss, and pain in the distribution of the affected nerves. Plexopathy is not a common condition, and precise epidemiological data can be difficult to obtain. Its occurrence varies depending on the underlying cause. For example, traumatic plexopathy is more common in younger adults due to higher rates of accidents. Radiation-induced plexopathy tends to occur in cancer survivors years after treatment. Brachial neuritis, an inflammatory cause, has a relatively low overall incidence. Therefore, it's more informative to consider the incidence of the specific underlying causes rather than plexopathy as a whole. The signs and symptoms of plexopathy can be quite diverse and depend on which plexus is affected and the severity of the damage. Common symptoms include pain, which can range from mild to excruciating, weakness in the muscles controlled by the affected nerves, numbness or tingling sensations, and a decreased ability to feel touch, temperature, or pain. In severe cases, paralysis of the limb can occur. For example, brachial plexopathy, affecting the shoulder and arm, might present with weakness when lifting the arm or difficulty gripping objects. Diagnosing plexopathy involves a comprehensive approach. A thorough physical and neurological examination is crucial. Doctors will assess your strength, reflexes, and sensation. Imaging techniques such as MRI or CT scans can help visualize the plexus and identify potential causes like tumors or injuries. Electromyography, or EMG, and nerve conduction studies are used to assess the electrical activity of the nerves and muscles, helping to pinpoint the location and extent of the nerve damage. While the term plexopathy is a general term, it is often categorized by the location of the affected nerve plexus. The most common types include brachial plexopathy, affecting the nerves of the shoulder, arm, and hand, and lumbosacral plexopathy, affecting the nerves of the lower back, hip, leg, and foot. Each type presents with different symptoms based on the specific nerves involved. Treatment for plexopathy focuses on addressing the underlying cause and managing the symptoms. If the cause is a tumor or hematoma, surgery may be required to relieve pressure on the plexus. Pain management is a key component, often involving medications like pain relievers, nerve pain medications, and sometimes injections. Physical therapy is crucial for regaining strength, improving range of motion, and preventing muscle atrophy. Occupational therapy can help patients adapt to their limitations and perform daily activities more easily. Preventing plexopathy often means avoiding potential risk factors. Practicing safe driving habits can reduce the risk of traumatic injuries. Proper lifting techniques can help prevent injuries to the lumbosacral plexus. In cases where radiation therapy is necessary, careful planning and techniques can minimize the risk of radiation-induced plexopathy. However, some causes, like inflammatory conditions, may not be preventable. The prognosis for plexopathy varies widely depending on the cause, severity, and how quickly treatment is initiated. Mild cases caused by compression may resolve completely with conservative treatment. More severe injuries may result in permanent weakness or sensory loss. Recent research focuses on improving nerve regeneration and function through surgical techniques, nerve grafting, and the use of growth factors. Scientists are also exploring novel therapies like stem cell treatments to promote nerve repair and functional recovery.